friends, my name is Dr. Kannan Kumar. I am an upper limb and hand surgeon practicing in Bangalore. My practice is exclusively upper limb and hand surgery. Today we are again going to talk about a very common problem that I face in my clinic, and patients have a lot of queries regarding this problem. We are going to talk about what is called as frozen shoulder. This is again a poorly understood problem. We are not very sure why it happens, but happens very commonly after the age of 50 with diabetes. And probably in a clinic, I probably see about 5 or 6 such patients every day. Now, what basically is a frozen shoulder, right? So our shoulder joint has a capsule or a covering around the joint, and in frozen shoulder, the capsule becomes tight and thickened, and the patient is not able to lift the shoulder. So basically, as the name suggests, the shoulder becomes very stiff. So this is a stiff shoulder most commonly because of diabetes. Many times we don't know why it happens. It can happen without diabetes as well. It can happen in patients with some kind of malignant condition. It can happen in patients with post-trauma, post-injury as well. But as I said, most commonly associated with diabetes. Now, what are the treatment options, right? Let us first look at the disease process. The disease process can take anywhere from 6 months to 2 years to clear. So once the pain and stiffness sets in, it can take up to 2 years for the patient to get better. A lot of patients are frustrated with the time duration that it is taking to get better. So you can divide the disease into 3 phases. The first phase is the painful phase, which takes the first 3 months. Second phase is the stiff phase, which can be about 6 months or so. And the third phase can last from 6 to 18 months, which is called the thawing phase, where the shoulder that has become stiff becomes free. You are able to mobilize the shoulder and it becomes free. So the first phase is very painful. First phase of painful phase, first 3 months. Second phase is stiffness without pain, and the third phase is a thawing phase where it becomes free. Now in the first phase where it is very painful, our aim is to reduce the pain. Right? So the main stage of treatment include physiotherapy, which is hot water fomentation, ointment application, gentle exercises. You should avoid sleeping on that side, that shoulder. Make sure you keep a soft pillow under the shoulder that is affected so that you don't put pressure on the shoulder. And avoid overhead activities. For example, like drying clothes or lifting something from the top and bringing it down. So you should try and avoid such overhead activities in the early painful phase. And if you have a lot of pain, you can of course take a painkiller which is safe for your stomach. For example, a paracetamol or a Dolo tablet can be taken occasionally for pain relief in this phase. Next, if you have gone on to the stiffness phase, we can mobilize, or you can do physiotherapy for range of motion exercises to free up your shoulder. There is no magic bullet treatment. It takes a while, and it slowly, progressively, the shoulder improves in its range of motion. And there are some cases which cannot be treated in this way, or they do not tolerate this treatment, or they're not responding to this kind of physiotherapy. Then we have to go ahead and do the next level in the management, which includes arthroscopic release of the frozen shoulder, or we can do manipulation under anesthesia. These are advanced techniques. Only about 2 to 5% of all patients will require this treatment. And finally, this whole thing takes about 6 months to 2 years. Some patients take a very long time. This is what we must all understand. We should not get frustrated with the long duration of treatment. And always spend a lot of time with physiotherapy and physiotherapists, and spend a lot of time in the sessions. And you should also work very hard at home to get the range of motion back. There's a very high chance that if you get it in one shoulder, you may get it in the opposite shoulder as well. So you must keep exercising and keep your shoulder mobility intact to prevent it from happening in the other shoulder. So this is all in brief about frozen shoulder. Hope you've got an idea about this. If you have any queries or doubts, please do get in touch with us. The contact information is given below. Please get in touch with me or my team, and we can help you. And we can shorten the process of frozen shoulder, reduce the pain, improve mobility in your shoulder. Thank you very much.